So last time I posted a video, and in the video I kept a link to a Google Drive, and inside that Google Drive I have the circulatory system as part of the videos, and then it is one of the things that we need to be very clear with before we take the USMLE step 1. So in this video we are going to talk about the circulatory system, and then I'll take you through the general overview of all the blood vessels, especially the arteries, so that you will be able to study them. Somebody wanted me to do this video, so I hope it helps other people too. So if you haven't subscribed to this channel, please do so. Share with your friends, comment, and also like. If you have any question, just put it there, and I'm always ready to answer them for you. So we'll look at the circulatory system, like all the blood vessels. So the purpose of this video is to understand all the blood vessels in the human body that we need to know for the step 1, and then I'll highlight the high yield ones that you need to know for the step 1. So we'll start from the heart. So this how it's gonna be. So I'll start with this over here. So as you can see, we'll start with this from the heart here, as you can see, and then we'll look at the ascending aorta here, and then we'll look at the arch of the aorta, the descending aorta. We'll look at the abdominal aorta here, and then we'll also look at the thoracic aorta at this side. Then we'll also look at the branches where it bifurcates, all the branches of the aorta. We'll look at all of them, and then the pelvic supplies, we'll talk about all of them. Those that goes into the arms, we'll look at it, and how it goes into the head, we'll look at all of them. So this video is going to be power packed. Wherever we get to and we get tired, we'll pause over there, and then in the second video I will continue from there. So please pay attention, and then let's do this. Again, if you haven't subscribed, please subscribe so that you always get this kind of video. And then this channel is to help most especially IMGs and anyone who is struggling with anything that I'm going to put on this video. And so if you have any question, go ahead and ask me, and I'm always ready to reply you. I'll start with this PPT. This is the PPT that is in the video, that the link that I posted in that video. If we should start, you can see this is a circulatory system, and if you open that PPT, it's the same thing. I'm not going to talk about the organization of the circulatory system, like the arteries, capillaries, and arterioles. No, we know those things already. We just want to know the gross anatomy of the circulatory system. So as you can see over here, the heart is in the pericardium here, and then that prevents the heart from overextending. And over here you can see here we have the brachiocephalic. This is a venous system here, but the arteries also come with it. So you can see the aorta over here. This is the arch of the aorta, and then it goes backwards, and then to become the thoracic aorta, and then under the diaphragm, it's below the diaphragm, it becomes the abdominal aorta. So we'll look at all those things today. So let's continue. Also, this is the blood circulation to the heart itself. So the heart also takes its blood supply from the aortic sinuses, and then they give the right coronary artery and then the left coronary artery, and then they also divide to supply the heart muscles itself. So we are going to start with this one, then later we'll look at the aorta. Okay. This is it. So this is the right coronary artery, and this is the left coronary artery. So I think this image will be the best for us for this presentation. So let me use this image rather. So this is the whole heart, and then this is the left coronary artery, this is the right coronary artery. So let's start with the left coronary artery. So the left coronary artery comes through here, you can see it over here, and then it goes through the anterior interventricular sulcus. So this is the right, this whole thing here will be our right ventricle, and then the smaller part here is the left ventricle. It's most posterior. And so it lies inside the groove, interventricular groove. This is the LAD, left, LAD. So that's left anterior descending artery. Yeah, this is our anterior interventricular artery. Is the same thing. So there's it, and so it has some branches over here. You see this branch over, this is a circumflex branch of it. Then the circumflex branch also goes behind to supply the back of the heart, and then you have this branch also here, also supplying the anteriormost part of the heart. That's the LAD. Supplies anteriormost part of the heart. Now this is the right coronary artery here. It also gives branches. So its branches, we have this branch over here that gives the SA nodal branch. It's going to the SA node. This branch here, this is a SA nodal branch. It's not labeled in this diagram. And then you can also see this will be our this is the right ventricle. So this will be our marginal branch over here, the right marginal branch over here. And this also has a marginal branch here, the left marginal branch also here. Now what's important here is, okay, let's talk about this also. The posterior interventricular is also at the back, but what's important here is that there's something that say left dominant or right dominant. It means that in 80% of the general population, the right coronary artery supplies the most part of the heart, the back of the heart, the SA node and then the AV node. So that means the person is right dominant. But then if the left coronary artery is the one supplying the SA node and the AV node, and then that means the person is left dominant. So, and then we have to know that 80% of the population is right dominant. So if somebody has an MI and then is having bradycardia, and then the question does not specify if the person is left dominant or right dominant, you have to assume that the person is right dominant. And then it means that the bradycardia is due to occlusion of the vessel that is supplying the SA node, because the SA node is the pacemaker of the heart. So just pay attention to the question if the person is left dominant or right dominant. If you are not told, then you assume that the person is right dominant. And also you can see the circumflex over here, and then it's anastomosing with the right coronary artery at the back. Here you can see it here, the posterior interventricular branch of the right coronary artery. It's the one at the back that is passing, the faint one. So they anastomose here, and that prevents the heart from dying, or it gives collateral circulation to the back of the heart. And then this one here, the left coronary artery, is the widowmaker, because it's the one that most likely gets injured. Now on EKG, what we are going to see is that if depending on the leads, okay, you have to put the leads on this vessel. So you realize that the V1 begins from here, and then from this area here, and then runs this way. So you have V1, V2, V3, V4, V5, and then V6 will be here. So if the person is having an MI that is on this side here, the left-sided MI, you realize that it will be in leads V5, V6, and then the AVL will be here. And then if the person is having an inferior MI, which will be inferior MI means that the posterior vessels, the PDA and then the PDA, yeah, most likely is the one, or the circumflex branch is the one that is occluded. So it will be at the back of this image, which is the faint vessel that we see over here, and that would mean that it's either lead 2, 3, and then the AVF. So that is it. And then if it's right-sided MI, also will be able to know that. So from here, all this side is the inferior MI, 2, 3, AVF, and then V5, V6, and then you have AVL at this side. But if it's an anterior MI, then it's gonna be this vessel here, this vessel, and this is the anterior interventricular artery here. it's gonna, and then that one usually would be our leads, the anterior leads, which are the V1 to V4, V4 over here. So that's the anterior MI. So this is just a little clinical addition that I want to add. And this is the coronary sinus over here. It is the one that receives all the venous returns from the heart, and then it drains it into the right atrium. So that's something that we should know over there. So this is just general overview. Okay. So now let's go back to our PPT so we can see it over here, the same thing that we talked about. So what did we need to talk about? Yeah, we also have the septal branches over here, the septum. The septal branches are also coming from both of them. So if the person is right dominant, the septum is most likely supplied by the right coronary artery. If it's left dominant, the septum is most likely supplied by the left coronary artery. So this is the same image over here. Let me expand this. Okay. Yeah. Okay, so we need to move fast so that. Okay, so this is the aorta that they have put over here. This is the ascending part of it. This is the arch of the aorta, and this is the descending part. And so now, what landmark helps us to demarcate this? This is the manubrosternal angle, the angle of Lewis. Okay, the angle of Lewis, that's what helps us to differentiate this. And then you have to know which vertebra it correlates with. You have to know which vertebra it correlates with. If I'm not lying, it should be between I think L2 should be. Sorry, not L2. I'm sorry, not L2. T2. This is a thorax, so we are talking about T2 probably. Yeah, vertebra T2. So just that, you can research into that, but you have to know it. So now let's continue. So what the most important thing here is that you want to know that on the left side here is different from on the right side. So on the right side, you have the brachiocephalic, which will branch into the subclavian, and then the common carotid. This side will be the common carotid. The common carotid will bifurcate into the internal carotid and then the external carotid. Yeah, so internal, this is the internal and external. The internal does not branch until it reaches the brain, but the external supplies the whole face and then part of the neck. So let's take note of that. And this also the thyroid EMA artery that supplies the middle part of the thyroid. Usually it's the that lobe. There is the pyramidal lobe of it, so it's also there. And now these two vessels, the subclavian here and then the common carotid, on the left side of the heart, they come directly from the arch of the aorta. So let's take note of that. It's different on the left side than the right side. Okay, so it's the same image here. You can see this, the lungs here. This is the lungs. After the lungs oxygenate the blood, it brings it through these vessels, the pulmonary veins, and then there are 4 pulmonary veins, 2 on each side. So just take note of that. And then also remember that these veins are carrying oxygenated blood. Even though all veins in the body carry deoxygenated blood, these pulmonary veins are carrying oxygenated blood. So let's take note of that. After the arch of the aorta, after the arch of the aorta, we get the thoracic aorta, right? This will be the thoracic aorta. Sorry, this will be the descending aorta before we get the thoracic aorta here. So the next slide is going to be the thoracic aorta. So this is the thoracic aorta. So if you want me to go back to this, we can look at this image here again, and it will be more clear. So this was the ascending aorta up to here, and at the angle of Lewis, and then this will be the arch of the aorta up to here. Here would be from here to here would be the descending aorta, and then from here to here just before it enters the diaphragm would be the thoracic aorta. So let's look at the branches of the thoracic aorta. It's very important that we know them as well. So this is a thoracic aorta. It gives us the esophageal branch. So this is a branch of the esophagus. This is the upper part of the esophagus, and then it has the bronchial branches as well. So right bronchial and then the left bronchial branches. We have the mediastinal branch. This goes into the mediastinum and then maybe supply the pericardium and then the mediastinal organs. And then we'll have the posterior intercostal branches. So the intercostal arteries are also, some are coming from here, but they are the posterior ones, because later we'll see where the anterior ones will come from. And then we have the subcostal ones over here. And so you want to know that the last branch of the thoracic aorta would be the phrenic, the superior phrenic branch. That is it. So these are the superior phrenic arteries over here, and then the diaphragm would be somewhere here like this. The diaphragm will be here. So now let's go to the next one. Yeah, so after it's the aorta enters there, after it enters the diaphragm, it becomes the abdominal aorta. And then you have to know what level each of the structures that perforates the diaphragm enters it. So that mnemonic is I add 12x at 8. I add 12x at 8. So just remember that mnemonic, and then it helps you. So after it enters, it becomes the abdominal aorta. Let's look at the branches of the abdominal aorta. So the branches are organized into the anterior branches. So these ones you can see they're coming from the anterior-most side, and then we have the lateral branches. Now the last branch of the thoracic aorta was the superior phrenic, right? So the superior phrenic. So here the first branch of the abdominal aorta will also be, because the diaphragm will be right here, would be the inferior phrenic. Now this inferior phrenic is going to give us two branches, giving us the phrenic branch, and then to give us the suprarenal branch. This is the adrenal branch, the suprarenal branch. So we realize that this is the renal arteries over here. This is a renal artery. Then so the kidney is going to be here. Okay, the kidney will be here, and then on top of the kidney you will have the adrenal. So the adrenal has 3 blood supplies, okay, 3 arteries. So the uppermost one is coming from the inferior phrenic, which is the suprarenal. So that's the superior suprarenal branch. Then the main suprarenal artery is here, and then the inferior one comes from the renal artery. So let's take note of that. So again, the adrenal gland has 3 blood supplies. Okay, let's look at them. Then they're all here, one here, and one coming from the renal artery. Now so we are looking at the lateral side before we come to the anterior branches. The next one that we can look at is the gonadal. The gonadal. So this gonadal means that it's both the ovaries and then the testes. So if it's in the male, you call it the testicular artery. If it's in the female, you call it the ovarian artery. So this is a gonadal artery. Now the gonadal vein is a little different. The left gonadal vein drains into the renal vein, but the right one drains into the IVC, inferior vena cava. So let's just take note of that. So this a question on UWorld. They want you to know the venous return. The fact that both of them are coming from the abdominal aorta does not mean that they also drain back into it the same way. And now there are other smaller vessels, the lumbar vessels, they are here, and you later at L4, the abdominal aorta bifurcates into the common iliacs, 2 common iliacs, one on the right, one on the left. The common iliacs bifurcates, also divides into the internal iliac and external iliac. As we progress, we'll look at all the branches. So let's just go step by step. Now, so we've seen the lateral branches. Let's look at anterior branches. The anterior branch, we have the celiac trunk being the first one, the superior mesenteric artery being the next one, and then the inferior mesenteric artery. So I'll just call this one celiac trunk, SMA, and then the IMA. Now, we'll look at all their branches and whatever they supply. The celiac trunk will supply the foreguard, the SMA will supply the midguard, and then the IMA will supply the hindguard. So let's proceed. And also we have one branch that I nearly forgot, the median sacral branch. This median sacral branch is is at the back, and then it's going anterior to the coccyx. Yeah, so that's the median sacral branch, the sacrum and the coccyx. Now, this is the subclavian artery. So we saw the subclavian. If I want to go back quickly, in this video, this is it here. This is the subclavian here. This is it in this picture. So there's a subclavian artery. So the subclavian is which one is this? It could be both of them. It's the same thing. So subclavian also has different branches. We don't have to know these demarcations for step one. This demarcation about the scalenus anterior muscle, it divides it into different parts, so but we don't really have to know it. So it's giving us the internal thoracic. So this internal thoracic, if you can see me, it's so this vessel, which is the subclavian vessel, it should be here. It has not yet gone into the arm, because after here it goes into the arm and then it becomes the brachial artery. So let's just take note. So before it goes into the arm, it's here, and then that's the subclavian. And then the first branch here will be the vertebral branch, and this vertebral branch is the one going to join to form the basilar artery to join the circle of Willis, right, to form the pica and co. Now, the next branch is going to be the internal thoracic branch. This internal thoracic rounds this way, anterior to the chest on both sides, and then as it goes down, it's going to give us the pericardiophrenal artery, and then it also gives us the anterior intercostal 1 to 6. You remember we said the posterior intercostal, where it was coming from. The posterior intercostal was coming from the thoracic aorta, as we saw in the previous slide. And now this one is the anterior ones, 1 to 6, is coming from the internal thoracic artery. Now let's look at other branches. We have the phrenic branch. So this branch is going to the phrenic, the diaphragm, and also you have the superior epigastric branch. So in if you've come across the inferior epigastric, that is it's a demarcation for to differentiate some hernias, and also it supplies the lower abdomen. This is the superior epigastric it's coming from above, and so this is it. And then we also have the anterior intercostals, also 7 to 9, and that's musculophrenic. Yeah, let's look at the next one. Okay, so in this slide, they've just summarized this. They've just brought the same image here. So you can see over here, this is our subclavian, and then these are the main branches over here. Probably I didn't finish all the branches. So this is the ascending cervical branch. It goes along, so we said it was here. So this ascending cervical goes up the neck. That's why we call it ascending cervical. And then when it goes, it gives us the inferior thyroid artery, and then also gives us the inferior laryngeal. So as it ascends up, it gives us the thyroid and also gives us the inferior laryngeal branches. And here also, it's also this thyrocervical trunk also gives us the suprascapular. And then we'll talk about this suprascapular when we do the rotator cuff muscles. And also we have the superficial cervical also here. Another branch of the subclavian will be the superior intercostal, and then the dorsal scapular branches. So we'll see also the dorsal scapula also when we come to the rotator cuff muscles. Now this image summarizes what we just talked about. So just a quick review of it. So this is the subclavian artery over here. can see it, and you see the internal thoracic running under the ribs, and then it runs this way. Okay, and it even gives us some branches to the breast. So the mammary branches will all come from this internal thoracic. We also have the thyrocervical trunk, which will give us, as the name suggests, the thyroid goes to the thyroid, which will be the inferior thyroid artery, and then some also go to the neck, right, as we said in the other slide. And now the next branch will be the transverse cervical. There's it goes this way. Transverse cervical goes this way to the neck, to the back, this way. And also we have the suprascapular over here, suprascapular. That will give us the supraspinatus muscle. So we'll see that in the rotator cuff muscles. Here also we have another branch here, which is the costocervical. Yeah, costo means what? The chest, and also the cervical to the neck. Now let's see the branches. The costocervical will divide into the deep cervical artery. This is not high yield, but then the other branch, the supreme intercostal, also not really high yield. So those that are high yield are the suprascapular over here, and then the costocervical trunk, you just want to know that, and then the thyrocervical trunk, you want to know because the thyrocervical trunk is given as the inferior thyroid. So let's pay attention to that. The superior thyroid will come from the external carotid artery. So let's take note of that. Now next slide. It's the same thing here. You can take time to look at the PPT. The same thing. They just wanted us to see that this is the right side, so brachiocephalic, and that is it. And you can see the nerves and the associations. Yeah. So this is what I was talking about. The internal thoracic. Internal thoracic here will give us the mammillary branches, right? You can see the medial mammillary branches, so it gives to the breast. So all this is coming from the thoracic. All this is coming from the subclavian artery. Yeah. And also we can see the other lateral mammillary. So this is the medial one, and there's a lateral one, which are coming from the lateral thoracic. And the venous drainages are also here. Then this is the vertebra, and this is how the aorta is right anterior to the vertebra. You can see it here. And then let's talk about this before, the posterior intercostal. So this is the aorta, the thoracic aorta, and then the posterior intercostal will just come from here. So all these things are not really hard. You just have to understand the anatomy. Yeah. So we saw this already, and then this is the abdominal aorta here. We saw all of its branches. They bifurcate at L4. So all the bifurcations are at 4, 4, 4. So T4, L4, and then and then so we can see the common iliacs over here, the internal iliac, external iliac, external iliac, internal iliac, and then the internal one is coming to the pelvic organs. The external one goes into the thigh to become the femoral, and then we'll see that. So this is it. You can see this is the gross anatomy. So you can see the internal thoracic running down here, and it comes and gives part to the diaphragm itself, and the last part of it here will be our superior epigastric artery, and you can see the inferior epigastric artery running over here, right? Inferior epigastric, this is it's running here. So and they join over here, and this will be the person's navel. The navel is also at L4. So let's just take note of that. Okay, now after this image, let me go back a little bit. Yeah, so this is what we said. After it has exited the thorax, it's going into the arm. So the subclavian now becomes the this after it has exited the thorax, and now it goes into the brachial artery. So let's look at it here. So now this is the subclavian as we saw in that image, and now it comes next into the armpit here. Just some short part of it goes into the armpit, just past the armpit. So that becomes our axillary artery over here, and then we'll see the function of the axillary artery also later in the rotator cuff muscles too. And then now it comes downwards to become the the brachial artery, as we can see over here. Before then, we have the anterior circumflex that goes behind, and then we have the posterior circumflex also going this way. So anterior comes anterior, posterior goes posterior, like that. And now it continues, and then branches into the deep brachial artery, and then we have the ulnar recurrent artery, we have the radial recurrent artery. Not really important here, not really important, but this deep brachial is important, so let's take note of that. We'll do that also later so that you see where the importance is. So it continues, and then it divides. You can see the brachial artery over here divides into the radial artery, the radial being the most anterior, and then the ulnar being the medial. Ulnar is more medial in the anatomical position. So yeah, that is it. And they go and join again. You can see it already, form an arch here. That's the superficial palmar arch. You can see it here, superficial palmar arch over here. We also have the deep palmar arch here, and now this arches now gives us the digital arteries, the fingers, so digital arteries. Yeah, not a lot of things that are high yield in here, but up here we have high yield. You have to know the axillary artery, the posterior, and then we have to know the deep branch over here, and then the ulnar artery, the radial artery is also very important. The deep palmar artery is also important. That one is in the palm, deep in the palm. That's why the name comes deep palmar arteries. Yeah. So it's the same thing that we have over here, same, but this one is going after the demarcations, but we don't really have to. We just have to know the gross. Yeah. So if you look here, we have the muscles around the scapula, and then the blood vessel distribution around the scapula. So we can see it over here. I didn't want to do this today. I wanted to do it when we come to the rotator cuff muscles, because I have a mnemonic that summarizes them quickly. So I'll do that right after this video. Okay. Yeah, same. And same, they just want us to know the positions. Same over here. We can see it here, the brachial artery here. And then this whole thing is the biceps here. It's passing medial to the bicep. You can see it here, and then it enters over here, and it becomes the radial artery here, and then the ulnar pass this way. Same image. Yeah. So we don't have to go into all these branches of the radial. Yeah. For this one also, we have to know this anterior interosseous branch, what it's doing, and we also have to know this other branch over here. Like this is a posterior interosseous branch, the anterior interosseous branch. They want us to know it, so let's just pay attention to that. Okay, that's the ulnar artery. So yeah, so there's a finger. We saw this already, the ulnar, and then the radial artery. They form the arch over here. We also have the deep palmar arch, and then this one gives us the digital arteries, not really high yield. Yeah. So this is the end of this PPT. Let's look at the next PPT, or we better end the video over here, and then we can do the second part in the next video. The second part is going to take the abdominal aorta, and then we'll look at its blood supply. So please, this is how it look like. So we'll take the abdominal aorta, we'll look at how it supplies the stomach, and then all the GI organs. I think it would be better to put that in a different video so that this video doesn't get too lengthy. So please, if you haven't subscribed to this channel, please do so. This is a very interactive channel. People ask a lot of questions that I know if I answer will help them. and I really answer those questions. So any question you have, please, any suggestion, any video that you want us to do, put it in here. This channel is for me and you, and hey, you can do it. The USMLE is doable. You can also do it. Thank you. See you in the next video.